From TikTok to Instagram, everyone is talking about weight loss injection. Yeah, this is real market trend. This is a hot topic of discussion among Gen Z as well as millennials. Some people call them it's a miracle drugs, but the other calls it's a dangerous drugs. So guys, in our today's video, we are going to discuss what are these drugs, who should use them, who should avoid them, and what are the side effects of these drugs. So let's start. These drugs that are generally available in the market under the brand name of Ozempic, Wegovy, and Mounjaro, in which Ozempic and Wegovy are semaglutide contains semaglutide. Means semaglutide is an active content of Ozempic and Wegovy, but their use case are bit different. And other one is Mounjaro, in which active content is Tirzepatide. Originally, some of these medicines were developed only for type 2 diabetes, but it is also specifically approved for the weight loss management in eligible patients. How do they work? It generally reduce appetite. It generally slow emptying stomach. It improve blood glucose level. It help you feel full for the longer. So semaglutide versus tirzepatide, how they act on the body. Semaglutide act on the GLP-1 receptor. What are these GLP-1 receptor? GLP-1 receptor are type of protein or glucagon-like peptides that is secreted by our intestine when you intake food. Means after you intake of food, this GLP-1 receptor release from our intestine and it control the release of insulin and consequently it control the glucose level of the body. Similarly, GIP. What is GIP? Glucose dependent insulinotropic polypeptide. These are also incretin hormone released from the intestine and enhance insulin release and fat metabolism. Subsequently, as the insulin release, it reduces the glucagon. It also reduces low gastric emptying, and that's why it reduces your appetite as well as increase satiety. Generally, these injections are prescribed once weekly, and the common injection site is abdomen, thigh, and upper arms. These are generally injected subcutaneously. So, what are the mechanism of action of semaglutide? Actually, semaglutide work on pancreas, and also work on brain, and also work on stomach. How these semaglutide work? As I have already told you that semaglutide are GLP-1 receptor agonist. It act on the pancreas, it increase insulin. As the insulin increase, it move more glucose from the blood into the cell and that's why it controls glucose optimally. Similarly, it decrease glucagon. What is glucagon? Glucagon is an hormone that increase glucose level in the body. But semaglutide block the secretion of this glucagon. It gives signal to the liver to release glucose level less and subsequently it decrease hepatic glucose production. Apart from the pancreas, semaglutide also act on the brain. It act on the appetite center in the brain and increase feeling of fullness. It also act on appetite. It reduce hunger and food intake. So these are the action of semaglutide. Now what are the action of Mounjaro? Mounjaro act on the GLP-1 receptor. Along with GLP-1, it's also act on the GIP. Means dual incretin advantage. Work on two pathways. Superior efficacy, greater control on HbA1c and weight loss, along with greater cardio metabolic benefit. As similar to the semaglutide, it also acts on the pancreas. It increases glucose secretion. It reduces the glucagon secretion. It also acts on the brain. It reduces appetite. It increases satiety. It also acts on the stomach. It is slow gastric emptying rate and feel full longer time. That may reduce calorie intake. Now, who should consider this medicine? Not everyone. Not everyone who simply want to lose few kg before going any vacation, wedding, or simple events. Definitely not for that individual. Doctors generally consider this medicine for the type 2 diabetes patient, for the hypertension patient, for the dyslipidemic patient, for the fatty liver patient, as well as for the arthritic patient associated with obesity. But these weight loss drugs generally work best when you adopt healthy eating, regular physical activity as well as long-term lifestyle changes. So what the question is arises, the question arises, can non-diabetic people use them? Yeah, non-diabetic people can use them, but prescribed by the health practitioner only when appropriate. Some of these medicine also approved for the weight loss management in people without diabetes, but who meet specific eligible criteria. So what are these eligible criteria? These are BMIs. You have heard about BMI, basal metabolic index. The normal BMI is less than 27. Means if your BMI is less than 27, you are healthy individual. But if your BMI is more than 27 but less than 29, 29.9, you can consider overweight. If your BMI is greater than 30, you may consider an obesity. So can overweight people take this medicine? Yeah. If overweight people means the people who have BMI between 27 to 29.9, along with any weight related condition like high BP, high cholesterol, sleep apnea, heart disease, and type 2 diabetes, can take in this medicine only if only prescribed by the healthcare practitioner. Otherwise, these medicines are generally prescribed for the obesity person. So what are the common side effects? Like other medicine, it can also cause nausea, vomiting, diarrhea, constipation. Some people also experience stomach pain, feeling overly full, and reduced appetite. But this is common side effect. Now, some serious side effect included severe abdominal pain, gallbladder problem, pancreatitis, dehydration, and some rare allergic reaction. Now the question arises: what happens if you stop? Will your weight maintain healthy throughout life if you stop this medicine? Yeah, but only when you adopt healthy diet, healthy lifestyle, you can maintain your weight lifetime. Otherwise, you will regain your weight after stopping the medicine because these medicine help manage weight, but they do not permanently change the body's tendency to regain weight. So if you stop the medicine and if you change your healthy habits, then you will regain your weight. If you want to maintain your weight lifetime, you have to eat healthy, you have to stay active at least 150 minutes of a moderate activity each week. Along with this, you have to adopt some healthy habits like manage stress, sleep well, stay hydrated, and the consistent weight management. Now, my final advice about weight loss injection, are they safe? No. If you taken this injection after prescribing by after advising by healthcare practitioner, it would be safe. But if you go simply and buy this medicine, it could be the poss possible adverse effect. So avoid buying this medicine from unrivaled source or self-medication. Always use this prescription under the guidance of healthcare practitioner. So, guys, all these about semaglutide and Monzero. If you find this video helpful, please like, share, and subscribe to my channel. If you feel that this video is helpful or informative, please share this video to your family and friends. If you have any queries regarding semaglutide and Monzero, please mention in your comment. I will definitely answer in my next video. Thank you. Bye bye.